Welcome to the Endpoint Epitrex training series. My name is Jared Smolarkevich and I will be walking you through this module. Please feel free to contact me or another member of our team with any questions or feedback you may have after the presentation. At Endpoint, we are always looking for ways to support you even better, and your input and questions help us do just that. A fundamental concept that is essential to grasp regardless of your role in the healthcare process is interoperability. During this module, we will be learning about interoperability by asking the following questions. What is interoperability? Who determines interoperability standards? And how are these standards used in healthcare? Along the way, we will also explore the evolution of healthcare standards, current interoperability for healthcare providers, and also for public health agencies. Lastly, we will touch on Epitrex solutions for the interoperability challenges facing public health today. The first step towards understanding a topic is to define it. Interoperability is defined as the ability to exchange data between different types of healthcare systems. This enables users to access and understand that data in accordance with the use cases that best fit their roles. For example, a patient accessing their own personal healthcare information on a patient portal website or mobile app may use this data differently than the providers who originally entered it as part of their electronic health record or EHR. Both the patient portal and EHR systems need a way to exchange the data in a uniform format that is both machine and human readable and fits the use case of each entity. This is where interoperability standards come into play. These standards ensure that the data transfers seamlessly from system to system in a uniform format that makes sense and fits the needs of both the patient and their providers, assisting them as they make important decisions about that patient's health. This affects every one of us, as that patient could be you. Since the earliest IT systems were developed in the 1960s, data standards have undergone many changes, not all of which have been widely adopted. In 1989, Health Level 7 version 2, or HL7 v2, was released. It achieved significant adoption and had two variants, HL7 version 2.3.1 and HL7 version 2.5.1, both of which are still widely used today. In 2003, HL7 version 3 was created, but major challenges prevented industry acceptance of this standard. 2 years later, the Clinical Document Architecture, or CDA, format was released, later becoming known as the Consolidated Clinical Document Architecture, or C-CDA. This is now the most common format for health information exchange in the United States. In 2014, the Fast Healthcare Interoperability Resources Standard, or FHIR, as it came to be known, was introduced by HL7. FHIR aimed to become the new standard for healthcare data, but nearly a decade later is still not as popular as C-CDA. A major challenge today in healthcare is that all of these formats still exist in some capacity, not to mention additional healthcare data formats like CSV files. The Interoperability Standards Advisory, or ISA, is the authority who governs these healthcare data formats as they evolve. More information about the ISA can be found at www.healthit.gov/ISA. When the ISA creates or updates these standards, the Office of the National Coordinator for Health Information Technology, also known as ONC, publishes and promotes them. The ONC's website, healthit.gov, has become a central hub for the latest standards regarding healthcare interoperability. The ONC is also responsible for distributing funds to public health agencies in the United States. Each state seeking ONC grants must meet with them periodically to ensure they are on pace in their implementation of the standards they have been awarded funding for. In the healthcare industry, patients, providers, and public health agencies all use diverse systems of applications. The data processed by these systems must be formatted in ways where they can communicate with one another. Since all previous data standards, like CSV, HL7 version 2, and other formats are still found in some capacity today, healthcare data systems must be able to convert them into a unified format like XML for data exchanges. Streamlining this process is essential to the success of public health. Without a unified way to exchange all this data in its various formats, clinicians and public health officials have struggled to communicate and work together effectively. EpiTrax provides a single solution for working with these various data standards and formats and can transform them into XML as well. This ensures that the information is available as soon as it is needed, exponentially increasing the response time to health concerns in the community. In an effort to modernize data exchange in healthcare, the Centers for Medicare and Medicaid Services, CMS, now require all providers to ensure that patient data is compatible with the HL7 FHIR API. Providers that fail to comply forfeit CMS funding. Another CMS requirement that applies to healthcare providers is that they must offer a directory of their clinicians that is publicly available via a standards-based API. Admission, discharge, and transfer event notifications must now be sent electronically between facilities. Providers must implement a process for electronic data exchange between healthcare payers at the patient's request. Non-compliant healthcare providers are publicly reported as information blocking by CMS. Those that do not ensure their contact information is accurate and up-to-date are also reported. Additional healthcare organizations subject to interoperability requirements include public health agencies, or PHAs. One area they must comply with includes electronic laboratory reporting, or ELR, capabilities. Electronic case reporting, or ECR, has also become the focus of interoperability requirements. Syndromic surveillance, which has been a regular practice of PHAs for over a century, is now also governed by interoperability standards. Immunization data is yet another area of public health that must be compliant. And lastly, public health registries for chronic diseases like cancer, birth defects, and traumatic injury must now meet all interoperability requirements. The monumentous task of meeting interoperability standards in all these areas to avoid losing essential government funding proves especially challenging for public health agencies in the wake of events like the COVID-19 pandemic. This is where EpiTrax comes to the rescue, with benefits that include offering implementation and support to satisfy all ECR interoperability requirements, providing a unified application for surveillance and case management, featuring customizable API capabilities for capturing external patient data. EpiTrax even has a portal for collecting non-standard laboratory reporting. Another useful component of this system is the independent NNDSS Modernization Initiative, or NMI module, for CDC reporting. Automated case creation within ELR functionality has also proven to be yet another handy tool for PHAs. In addition to all these advantages, EpiTrax can also handle all reportable conditions as opposed to using separate applications to report each case type. All these features and benefits work together to make EpiTrax the effective and affordable powerhouse system of choice for a growing number of PHAs across the country. In summary, interoperability standardizes the exchange of healthcare data to be machine and human readable. This is designed to fit the unique needs of each end user as they make important healthcare decisions each day. Interoperability standards are created and revised annually by the ISA. The ONC then awards funding to state PHAs that implement and comply with those standards. This impacts everyone in healthcare, from patients to providers, to public health agencies within the communities where we live. Interoperability standards have evolved significantly over the past several decades, and not all versions have been adopted. Currently, C-CDA and HL7 version 2 are the most common interoperability standards, while FHIR is the latest available. EpiTrax is the comprehensive and affordable solution for PHAs facing the challenges of remaining compliant with interoperability requirements to keep essential government funding. we hope you found this presentation engaging and beneficial. Endpoint team members looking for additional resources related to this presentation and others in the EpiTrax training series can find them by searching with the keywords EpiTrax training on the Endpoint Company Wiki. Thank you for watching.